So this is your OSCE skills preparation workshop 2, in which we'll be focusing on the second set of 5 of your 10 skills, which are on your feedback 4, which will be the document used by your examiner for your OSCE, and which you'll receive in terms of your feedback, both in terms of performance and also the grade. So today we're going to look at S4, paraphrasing, S5, reflecting, S6, linking, S7, clarifying, and then finish with S8, questioning. And of course, you'll then be going into your third workshop, a consolidation session, later in October, where you'll have the chance to do these skills again. Also, the idea behind these workshops is that they are an opportunity for you to see a way of working in relation to learning these skills, which you will go away and repeat and hopefully develop as well in terms of your self-directed study, whether it's with a study buddy or in a small study group, going away and practicing these skills in the same way in which we're presenting them to you in this workshop format. Like any of our learning here, most of it is done by you as adult learners in your own time. But you've got resources from the university to help, not least of which, of course, all the material that I'm putting on Moodle for you in terms of the OSCE channel. So the videos, the references, the written material, etc. But for now, let's carry on with today's first skill. Paraphrasing, S4. Okay. So we'll play the video in which we'll get a definition, a description, a how not to do the skill role play, and a how to do the skill role play. And I'll post all these videos on your Moodle, the OSCE channel, for you to watch, rewatch, etc. as you are practicing, rehearsing, right up to your January examination. Okay? Let's go then, in terms of paraphrasing. At this point, watch the video. I'm not going to play it. I'm going to talk to the video in the sense of give you a couple of pointers in relation to the definition, description, and also hopefully help you in terms of going away and practicing it yourselves. So the definition, it's all well and good and fine, and I don't disagree with it, to be honest with you, but I would say one thing in terms of our definition of paraphrasing and how we will be looking for it, and therefore examining it in your performance in January in your OSCE. A paraphrase is when we use our words to feed back to the patient what it is that they've been saying in terms of the fact, content. So it's our words, the factual content of what's being said. You really want to be focusing on a key word, key idea, and you really want to be reducing it down in your paraphrase. So if the patient's been talking for a couple of minutes, you're not going to be feeding back to them 2 minutes worth of paraphrase. That's not a paraphrase. Okay. Okay. Moving on then. Reflecting. Again, it's defined, described, and there's a how not to and how to role play in the video clip that's part of this workshop and that is on your Moodle after this workshop. What we want to establish, bearing in mind that you're doing a lot of background reading and therefore coming across definitions of reflection and reflecting which contradict each other, okay, in the literature, which is fine, but it's no use for us in terms of examining whether or not this skill takes place. So our definition here, and the one that we use for your OSCE, is a reflection is the interviewer feeds back what the patient has said using the patient's word or words, and the subject matter which is being fed back is the emotional content of what's being said. Okay? So the best way to remember reflecting is by remembering paraphrasing and putting the both together and realizing that in many ways they are doing the opposite. Paraphrases are your words, reflections are the patient's word or words. Paraphrasing is about the factual content of what's being discussed up to the point of the paraphrase. Reflecting is about the emotional content of what's being discussed up to the use of a reflection. One point to make at this stage: you use these interventions for the benefit of the patient in terms of the patient hearing themselves, coming back to themselves, so as to provide forward movement in their progress. You decide which of these interventions you're using and when you're using it, how you're using it, based on the thought, the monologue that is going on in your head at the time while you're interviewing, which is saying what would be of most use to the patient at the moment. What would be of most benefit for the patient at the moment? Would it help them if I came in with a question here? Is a clarifying better? Or in the case of what we've done so far today, would a paraphrase be more useful than a reflection, or vice versa? Again, they will be used in slightly different ways. So for example, outside of the introduction and the conclusion, I'd guess that paraphrasing would be something that would be getting used consistently throughout the entire remainder of the interview. And if you think about the nature of the skill, it should be self-evident why. However, in contrast, I'd imagine reflecting to be taking place essentially in that middle part of the interview. So if I'm interviewing somebody for 30 minutes, that means that I won't be using reflecting properly for somewhere around that first, perhaps 10 minutes. Likewise, I won't be using reflecting in that last part of the concluding part of the meeting, that last 10 minutes. But what I will be doing is I'll be using reflecting perhaps as my main intervention, perhaps my only intervention in terms of my use of my skills in that kind of period of the interview between 10 minutes and 20 minutes, that middle. And again, it should be self-evident in terms of why, if you think about the definition of that particular skill, we're not going straight into reflecting and reflections when we've just met the person, we're just beginning the interaction, and we're trying to build rapport, get into people's feelings and that kind of material. And at that stage, then you run the risk of shutting them down, scaring them off, etc. Likewise, you're not dealing with people's emotional world while you're heading towards the end of an interview. You've got to be helping the person to psychologically shut themselves down so that they can return back into the community. And we don't leave anybody going back into the community having been opened up and vulnerable. Okay? So moving on. Linking essence. Linking is connecting. The video definition and descriptions focuses on emotions and thoughts, emotions and behaviors. Anything can be linked in terms of linking is connecting. Connections need to be made in many ways. You can describe disorder and distress, lack of order, as being lost connections, as you can see from the patient in the role play. She's grieving, she's crying in supermarkets. She's not putting those two together in terms of affect and behaviour. Now, they're not the only connections you can make. As I say, you can connect between, for example, the individual and the social, the external and the internal, the objective and the subjective. Any kind of classic oppositions that you can bring together. From our perspective, we're looking at you making those connections on behalf of the patient in terms of the story they're telling you. But of course, from a therapeutic perspective, our aim is actually to arrive at a position where the patient themselves starts, as they progress through therapy and improve, to themselves be able to do that. And ultimately, the linking will or can develop into the use of interpretation, and that can be specific to different types of clinical work and theoretical models. But as an example of how these basics that you acquire in your minute could potentially become much further on and later on in your career, more nuanced and sophisticated ways of working. Moving on then from linking to clarifying. So again, the clarifying is defined, described, and we see how not to and how to in the video. One of the things that I want to impress upon you is that clarifying is inevitable once we get into a story. There will always be parts of the story which are less clear and parts of the story that are more clear in terms of how they've been communicated. The important thing is that the clarification is not for your benefit. So when you use it, you're using it in order to increase the awareness of the patient about themselves. You shouldn't get confused with the idea of finding out information, confirming information, and getting details correct. They can always be checked out at another point and potentially in other ways. Clarifying is much more than merely information seeking. And it really doesn't speak to the idea that this is for your benefit, because ultimately nothing should be for your benefit in what should be a patient-centered activity. You use clarifying in order to increase the understanding of the patient about the patient themselves. Now that may be evidenced by you, as in the example of the video, checking out a particular phrase that's being used, but that's for the benefit of the patient. The example in the video is where the patient uses the expression checking out, something along those lines. We want the patient to hear that coming back to themselves so that they can gain a greater understanding of what it is they're talking about, and the reality of it, etc. And start to work on that. I'd like to highlight that the counsellor involved in it will start to second guess, but she needs to be adopting a not knowing approach to the work. A not knowing approach that's okay with being ignorant of what's being discussed. A not knowing approach that is saying, I'm not the expert in this. I don't come here with all the answers. You're the one with the answers. Let's help you to find it out. Okay. And finally, questioning. Okay. Again, definition, description, how not to and how to in the video, and some elaboration on the part of the counsellor, very much along the classic lines of the difference between an open question and a closed question, sorry. And again, they don't go into the detail, but one of the classic approaches in terms of questions is, in clinical interviewing, you do not get into a question answer, etc. structure. Okay, that is an interview. It is not a clinical interview. Indeed, there are some approaches, some models where interviewers, clinical interviewers in a clinical interview will not use questions, or perhaps use one question only, and that would be an open question, and that would be right at the beginning. Certainly from our perspective, in terms of your performance at this stage and your use of this skill, what we're looking for is that you don't fall into the classic trap of thinking that this activity is all about questions and questioning, and that you then don't, as a consequence, fall into the potential trap of getting into a question answer, etc. structure. And so when you are doing your role play, try and be the interviewer and start an interview without using a question. What would you use? How would you start your role play? And for our purposes, in terms of you actually being able to learn the skill and demonstrate the skill, when you're working with your colleague or colleagues, or by yourself, in your bedroom with your mirror, practicing being an interviewer, think of what you're doing not in terms of interviewing a patient. Start with just thinking about actually having a conversation with a peer, a colleague, one student with another, where you're the one who's taking the lead, perhaps. Therefore, you can arguably be called the interviewer. And where the topic is perhaps something, how I got to university this morning. Use that as your topic. Give yourself a couple of minutes, basically, to start a conversation going. Be the interviewer. Your colleague who's working with you, who will engage and cooperate at all times, as a fellow student talking about their journey to university this morning, can then engage with you. And as the interviewee, give your interviewer a little bit of material. Help them in the sense of engaging and cooperating. Obviously don't do the work for them, but when you're interviewing, use the skills. Or actually, in terms of questioning, do not use the skill. Start the interview without asking a question. The topic is how you got to the university this morning. Start. So hopefully that was useful for you. In terms of the material I've posted, etc., and that particular activity, have a look at how Rogers begins his interview with Gloria. Another challenge in terms of going into this work further and your preparation, particularly in your self-directed study and OSCE prep study groups, or with your study buddies, or with your bedroom buddy. Think about what the next stage is once you've had the reply from the interviewee, in terms of having started the conversation and having started it without asking a question. You started, the interviewer comes back, the interviewee, sorry, comes back with their response. How do you carry it on? How do you carry the conversation on? And again, without using a question. Hopefully, once you gain experience and skill in not using a question, you'll realise just how powerful they are as interventions. Hopefully as well get an idea of just why it's so important that you don't overuse them. Like a lot of powerful stuff, it's best used in moderation. And that brings skills session 2 to a close. We've now done all 10 skills. You've got the videos on the Moodle. You've got skills session 1 and skills session 2 in video form. You've got written material and references. What I'd advise is that you visit and revisit all of this material, actively engaging with it in very much the way that we've discussed previously in various sessions. So for example, watching a video or an interview whilst filling in the interview schedule that you'll be using in your OSCE. Breaking down parts of interviews and role-playing them yourself. Using that model to then give yourself further exercises with your study group, etc. Getting yourself study room, study space. Having a session where you focus perhaps on just 1 or 2 of the skills. Perhaps do entire rehearsed 30 minutes, run throughs in terms of your interview. You don't want to be going into your OSCE without having done as much rehearsal as possible. We'll talk more about various aspects of this, including note-taking, etc., in the consolidation session, skills session 3. But we've touched on things like note-taking already in some, if not all, of the skills sessions 1 and 2, and also in main lectures. If I were a student doing this OSCE, I would take notes. I would be using the interview schedule that the joint module leader had created and posted on Moodle for me. I would be taking in that one piece of A4 in good order with a clipboard, and I'd probably have my timepiece on the clipboard. I'd make sure that when I was using the clipboard, it was always flat on my knees in terms of my solar active listening skill. It would never be raised as a barrier between me and my patient, or the patient and me rather. And also, whenever I would be taking notes, and would be notation. So have a look at people who do take notes, have a look at their interview notes. You'll see it's abbreviations, it's symbols, okay? You don't write in sentences. It's notation, you make notes. And if they are contemporaneous, if you are making notes during the actual event, you need to be able to do so that you can maintain appropriate levels of eye contact and so that you don't stop the conversation. That for now is enough in terms of skills session 2. Thank you.